The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors, patients and dentists alike. I think we can quantify and qualify patients who have been on a war path to solve their TMD symptoms as TMD warriors along with the dentists. As I stated in earlier episodes, more and more patients are watching these episodes of TMD Demystified on Dental Town, which is the platform. And so I thought I'd acknowledge that in the introduction. I am Tony Urbanek. It is appropriate to call this problem, TMD, into play as a warrior, because actually it's an easy solution, but it has not been an easy journey to get here. With me, it's been a 50-year journey since I first finished my training, and I did have, for the time, 50 years ago, extensive training in understanding the theory and the actions, and specifically the surgery as it applies to temporomandibular joint disorder. I'm not going to bore you with any of the features that went on over 50 years, but I can say that for 50 years, it has been a journey for me. First 36 years as a surgical journey, doing over 2,000 TMJ cases, and then for the past 14 years, addressing this problem non-surgically after actually finding the solution for TMD. But before I found the solution, I had to find the actual pathology. I had to find the exact mechanism that allows this process that everyone calls TMJ to occur. Brings to mind just a fact. My associate was talking to an anesthesiologist very recently who was getting ready to do a procedure and anesthetize my associate for a brief procedure, and found out that he treated TMD and asked what TMD was. And my associate explained to the anesthesiologist what TMD is, and he said, "Oh, well, you mean TMJ." Even the anesthesiologists still call it TMJ. Everyone calls it TMJ. All right. The concept, the title, and the topic for today is, why do 50% of dentists prescribe a night guard for TMD? And that is a fact. 50%, roughly, of maybe more, of dentists, when they are faced with a patient that they believe have TMD, temporomandibular joint disorder, prescribe a night guard. And we're going to discuss here, hopefully thoroughly, but relatively briefly, I don't want to bore you, with why. The issue with night guards is they don't work in treating TMD. So why would 50% of the dentists prescribe a night guard for treating TMD? Well, the easy answer, and I've given this a lot of thought and investigation, and discussion with dentists. First of all, the easy answer is they don't know why they prescribe a night guard. The easy answer is that that's what everybody else does. And they have heard one way or another that that's what everybody else does, or they have an associate that that's what they do, and so they prescribe a night guard. That's the easiest of the answers. The second easiest answer is the dental schools don't train anything as it relates to treating TMD. And if they do, they just use a night guard. So the basic information comes out of dental school as to the right way to treat TMD. And then, of course, because there is no standardized treatment recommended or taught in dental schools, or no treatment at all is taught in dental schools regarding TMD, it leaves a big void. And it has been a big void for 50 years, both surgical and non-surgical. My surgical associates, compatriots, colleagues, had multiple answers, surgical answers. There wasn't one answer. There wasn't a standardized surgical answer. There were multiple answers given as to how to properly treat the TMD disorder and symptoms of TMD surgically. Two categories. One of them, it was through open joint surgery, where you would make an incision into the joint and do various machinations on the joint itself. We won't go into that. That's a surgical discussion. Or secondly, through an arthroscope, which is less invasive, but definitely less effective than any kind of open joint surgery. But those were the two types of surgical concepts that were used, scope versus open joint. And then the non-surgical treatments were more varied than the surgical treatments, all over the hill. I mean, just all over the place. So the question is, what really it boiled down to is 50% of the dentists really didn't want anything to do with treating TMD, because they knew by observation and experience with patients coming into their office and maybe being treated for a while with a night guard, finding out a night guard is not effective, and then they're out of bullets. They don't know what to do. And that's why 50% of the dentists, the other 50%, when they're faced with a TMD patient, either close their ears and say, I don't want to see the patient, or doesn't want anything to do with learning about TMD because they know nothing works. And then there's the 50% that use a night guard. All right, so, but what I want to discuss, hopefully briefly, is the logic or illogic behind using a night guard, because I gave us a lot of thought. And I assume that my dental colleagues, for the most part, are logical people. I mean, they're all smart. They're all smart enough to get through college, and also smart enough to get an invitation to go to dental school. And almost everybody finishes once you get into a dental school. Pretty much everybody finishes. So they're pretty smart, ladies and gentlemen. But why then do 50% of them keep prescribing a night guard when they're faced with a patient with TMD? Well, here is part of this week's blog that I wrote. So I'm going to have to read it to you to make sure I get it correct word for word. And then hopefully we'll make some sense of it. Maybe you'll kind of get a kick out of it like I did. 50% of dentists treat TMD by prescribing a night guard. A night guard is a plastic resin or acrylic tray that covers the surfaces of the teeth, to be worn at night for patients who clench or grind their teeth. It is well known and accepted fact that patients who clench or grind their teeth at night can damage or break their teeth. This is true. See it all the time as an oral surgeon, broken teeth because of clenching and grinding. Clenching and grinding of the teeth is called bruxism. So far, everybody's in agreement. It makes sense to protect the teeth from bruxism by covering them with a night guard. Night guards are successful at protecting the teeth from breaking or breakage due to bruxism. That's a fact, an agreed upon fact. It is also well known and agreed upon that bruxism is one of the 3 causes for damage to the temporomandibular joint. Actually, if you are looking at the percentages, bruxism actually is the most egregious and causes most of the damage to patients who have temporomandibular joint disorder. There are 2 other causes for damage to the temporomandibular joint, which are acute trauma and functional malocclusion. Bruxism, acute trauma, and functional malocclusion damage the TMJ, creating chronic inflammation. That is also a fact. Just read that again because that's an important fact. Bruxism, acute trauma, and functional malocclusion damage the TMJ joint, creating chronic inflammation. So far, we're all in agreement. But the illogical reasoning behind using a night guard for TMD is as follows. I gave this quite a bit of thought. When I was in college, I actually took a logic course where they teach you syllogisms. And I don't rely on logic to solve all problems in life. That is not what I'm saying. But I did take a logic course, and the major part of the logic course was to teach you syllogisms. If this is true, if this point is true, if this point is true, then the third point must be true. But a syllogism can be logical or illogical, actually. And the syllogism for night guards is very illogical, but here it is. Night guards are successful in preventing damage to the teeth from bruxism. True statement. Bruxism is one of the circumstances that leads to TMD. Also a true statement. We just went through those 2 points. Therefore, night guards should be used to treat TMD. That third point is not true. And it's not true because both dental damage and TMD are associated with bruxism, but association does not prove cause. They are both associated with TMD for sure. Bruxism is associated with TMD, and night guards are associated with TMD in that they prevent damage to the teeth due to TMD, bruxism. But therefore, night guards should be used to treat TMD is not a true statement. Association does not prove cause. Just because they're associated does not prove cause. But 50% of the dentists in the United States of America, when faced with the patient with TMD, will prescribe a night guard. So file that away. In our practice, I've talked before, we frequently see patients come in with multiple night guards. Some of them they've chewed through, some of them not. Some of them have been made by multiple different dentists as a solution for their TMD. In fact, some of them will come in with a paper bag, usually a brown paper bag, and they'll shake the paper bag and they say, would you like to see what I have used for my joint problems, TMJ problems? And usually I'll say, well, if you'd like to show those to me, I'll look at them, but I already know what's in there. Bunch of night guards. True statement. So is there anyone out there but me that sees the fallacy of this syllogism? But 50% of dentists treat TMD with a night guard. They are actually taught that in dental school, which is to say a lot about the current quality of instruction about TMD by the dental elites. educational elites. Doesn't it make sense to treat the cause of the problem rather than the symptoms? So the symptoms of TMD are, as I've spoken before, many, 10 major symptoms: frequent and/or recurring headaches, earaches, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, which is a feeling of fullness in the ears, dizziness/vertigo. They're similar, but not identical, but they're similar. Upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the 10 substantial, agreed upon symptoms that anyone who sees many TMD patients will see patients with one or more, multiple of those symptoms. I had 2 patients yesterday who had all 10 of those at the same time. Of the 6 consults I did yesterday, 2 of them had each and every one of those symptoms. But does it make sense to treat symptoms if you can just treat the cause? If you treat the cause, then the symptoms don't originate. The symptoms go away. They either don't originate if they have not occurred already, because TMD is a progressive problem. It starts out with just a little clicking, click, 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 click. Then it goes to pop, pop, and some intermittent locking. Then it can go to permanent locking, along with one or more of those 10 symptoms. But if you can treat the cause, the direct cause of every one of those symptoms, you don't have to treat symptoms, you just treat the cause. And treating the cause is fairly easy when you understand the mechanism. The mechanism that creates all those symptoms is chronic inflammation, and chronic inflammation's effect on the autonomic nervous system, which has a substantial effect on causing muscles to get tight through the autonomic nervous system. It's not a matter of how much motion of the muscle. It's not a matter of the motion of the muscle. It's a matter of chronic inflammation stimulates the sympathetic portion of the autonomic nervous system to send signals to tighten up the muscles, not just of the jaw, not just of the masticatory muscles, but including the neck and the shoulders. And so the painful symptoms associated with TMD include headache, earache, jaw pain, neck pain, upper back and shoulder pain, tightness, arm, hand, finger tingling, and numbness. The painful symptoms that move around all the time from one place to another because the nervous signals go to various muscles at various times under various circumstances. So here is a logical syllogism, the logical syllogism that explains why the urbanic device and protocol is so effective in treating TMD. Chronic inflammation directly creates all the disparate symptoms of TMD. Chronic inflammation in any joint is best treated by taking the load off the joint, like a set of crutches takes the load off a knee, or a sling takes the load off a damaged elbow, allowing it to heal. We know, orthopedic surgeons know, that if you have a damaged knee, even a knee that needs surgery on it, if the patient doesn't want surgery, if the orthopedic surgeon places the patient on a set of crutches, the pain's going to go away because you unload the knee. If you have tennis elbow, which is inflammation of the lateral epicondyle of the elbow, the proper treatment is to put the patient in a sling to rest the elbow, to allow the inflammation to go down here. And as I've spoken on before, tennis elbow is the same disease as TMD. Tennis elbow creates inflammation in this joint, in the lateral epicondyle, which sends a signal to the brain stem, and probably including the amygdala, which sends signals back down through the autonomic nervous system to tighten the muscles that move the elbow. And the pain of tennis elbow is not so much here, they complain here, where the muscles get signals to get tight and pull on the bone, where the nociceptors are, receptors are for creating pain. Tennis elbow and TMD are the same disease. And they both operate and respond to unloading the joint. So I'll just repeat the last point. Chronic inflammation in any joint is best treated by taking the load off the joint. It's easiest, for sure. Like a set of crutches takes the load off a damaged knee, or a sling takes the load off a damaged elbow, allowing it to heal. Therefore, the urbanic device and protocol unloads the temporomandibular joint like a set of crutches unloads a diseased knee or a sling, a diseased elbow, decreasing and diminishing chronic inflammation, allowing it to heal. That is why this simple, very simple device that fits in the roof of the mouth behind the upper front teeth, separating the posterior teeth, where 90% of the loads on the joint come from the posterior teeth. 90% of the loads on the temporomandibular joint are created by forces through posterior occlusion, posterior teeth. So when you disocclude the posterior teeth, you're taking 90% of the loads off of the joint. When you unload a joint, like a knee or an elbow or a TMJ, the inflammation will decrease, and when the inflammation decreases, there are no longer signals coming down from the brain that says tighten up. And when that occurs, the muscles are no longer getting signals to tighten up, and the painful symptoms of headache, jaw pain, shoulder pain, upper back pain that move around all the time diminish and go away. True statements. So that is the explanation. That is the explanation of why do 50% of dentists prescribe a night guard for TMD? Because they're operating with an illogical syllogism. It is not logical to say night guards are successful in preventing damage to the teeth from bruxism, and bruxism is one of the circumstances that lead to TMD. Therefore, night guards should be used to treat TMD. No, you can't say that, because both dental damage and TMD are associated with bruxism, but association is not proof of cause. All right, I won't carry on any further. I'll look forward to selecting a topic for next Tuesday when I do these. If anyone out there would like to discuss it with me or criticize me, I can be reached at tony@tmjservices.net. I accept criticism graciously, but be prepared with your information. You have to define your terms. You have to define your terms, and you have to bring your logic and your information with you that proves your point, and then I'll be happy to discuss it and be criticized. With that being said, we'll call it a day. I am Tony Urbanek, and this is TMD Demystified.